New research has shown a strong link between severe vitamin D deficiency and mortality rates amongst COVID-19 patients. Now, vitamin D plays a major role in both enhancing the immune system and preventing it from becoming dangerously overactive. This means having healthy levels of vitamin D could protect patients against severe complications, including death from COVID-19. For more on the study that was conducted, we're joined via Skype by Giulia Criscuolo, a pharmacist, complementary expert, and also a life coach. Giulia, a very good morning to you. Thanks for joining us. Welcome.
Hi, Simpiwe. Wonderful to be with you.
It's an absolute pleasure having you. Now, researchers have discovered a strong link, Giulia, between severe vitamin D deficiency and mortality rates among COVID-19 patients. So good to know. Can you tell us more?
Yes, Simpiwe, the study was actually carried out at Northwestern University in Chicago. And they actually looked at 10 different countries, including the US, UK, Spain, Italy, and China. And they found an absolute link between low levels of vitamin D and complications from COVID, including mortality. And they actually found that people who were low in vitamin D twice as likely died from COVID-19 as those who had normal levels. And also they find, people talk about the cytokine storm. There's definitely a correlation between vitamin D and the cytokine storm. And that's that hyperinflammatory response that happens in the body in response to the virus, which causes a lot of lung damage and leads to acute respiratory distress syndrome and, in many cases, mortality. So having good levels of vitamin D stands you in good stead when you are exposed to the virus, supports the immune system, and gives you a much better chance of overcoming it.
Now, Giulia, what are some of the health benefits of vitamin D?
Well, vitamin D, which we are so blessed in South Africa to have good sunshine because it's made in our skin when we are exposed to the sun. Vitamin D is very good in terms of helping calcium be absorbed into the bones, together with vitamin K2. It's also very important for healthy teeth. It's so important for your immune system. It really has a powerful impact on the immune system. It's good for cardiovascular health, for brain function, and also has a positive impact on insulin. So it's very good support for diabetics. And it also has an impact in gene expression in certain kinds of cancers. So quite a wide range of benefits to the body.
Well, just how common is vitamin D deficiency, and can a diet help boost vitamin D levels, and how?
Worldwide, globally, there's a 15% number of people who are actually deficient in vitamin D. Now, in South Africa, you would think because we have so much sunshine, that wouldn't be a problem. But unfortunately, many people don't get sun exposure every day. We are, especially during this time, living indoors a lot, not getting enough sun on our skin, and also wearing sunblocks does impede the vitamin D that gets into our skin. So people who are high risk are housebound people, the elderly, very young children, people with darker skin because of the high melanin concentration. But luckily we do have good foods that are richer in vitamin D, like beef liver, fortified cereals and milk, egg yolks are high, and also oily fish like salmon, mackerel, and fresh tuna. Those are some good sources of vitamin D, and of course, our wonderful free sunshine that we get in this beautiful country.
And good to see that we have that in abundance. Now, the World Health Organization, Giulia, suggests that we should all be supplementing with vitamin D. Do you agree? And if so, which supplements do you recommend?
Yes, I absolutely agree with that. I believe that the vitamin D sprays are the best way of getting vitamin D into your body, because the spray is given into the inside of the cheek, and that's a wonderful platform for maximum absorption. In fact, there was a study done by Cardiff University that showed that there was a 227% better level of vitamin D in the blood when taken through the spray form compared to a tablet. So the absorption of vitamin D into the body is very, very, very much better in a spray form compared to a tablet. Also, the sprays are very economical, they're very convenient, and they're much more pure. There's no extra additives added when compared to tablets. So I really like the vitamin D sprays as a way of getting extra D into the body.
Okay, and what about vitamin C? Do you also recommend supplementing? And if so, what do you suggest?
It's absolutely known and proven that vitamin C has a direct positive impact on our immune system. And we know that if our immune system is strong and robust, then whatever affronts us, virus, bacteria, parasites, our body is able to fight it and restore the body back to balance. And vitamin C has a role to play in that. However, vitamin C is a water-soluble vitamin. So when you take the vitamin C, it doesn't last very long in the body, and actually you pee it out quite quickly. So I believe that, with any supplement you take, quality is so important. So the liposomal vitamin C, which is basically vitamin C packaged in a molecule that is surrounded by little lipids, microlipids, and that's why it's called liposomal. This form of vitamin C is well absorbed into the body, and also it stays in the body for a longer period of time. So you don't have to take so many dosages, and the body can benefit from a longer period of having vitamin C in the blood. So the liposomal form is a really great form of getting vitamin C into your body, supporting your immune system, and giving you a fighting chance when you're exposed to any kind of bugs.
Just a quick one, Giulia, before I let you go. We know that overexposure to the sun has its own problems. It can be detrimental to your health. So how much time do you recommend we should stay out in the sun to get vitamin D?
All we need, Simpiwe, is 15 minutes a day, and usually before 11 o'clock when the sun isn't strong. So that's a good time. Before 11 o'clock in the morning, just 15 minutes is all that you need to get enough sun exposure to make enough vitamin D for you. Okay. So after that, absolutely sunblock, be careful, be responsible.
Okay, thank you so much. We'll definitely do that. Thank you so much for your time and for your reflections, Giulia. We just spoke to Giulia Criscuolo, a pharmacist, a complementary expert and also a life coach on the recent study and research that discovered a strong link between severe vitamin D deficiency and mortality rates amongst COVID-19 patients. It is 7:46. We'll take a quick break. We'll have more in a moment.
Information